Good morning. Hello, my people of the internet. This is Okongo, um, Ouma, pharmacist again. And today, as I promised, that we'll be doing a video on two medical conditions that affect men of all reproductive ages. And these are erectile dysfunction and premature ejaculation. So, we'll dissect all these two conditions, dig in through, get to understand what are they and what happens in any case, and maybe the causes, how do you manage them, and the impact on the sexual activity of men. I'll start by a brief background on the sexual organ, basically the male sexual organ and how it functions. The male sexual organ is called the penis. Um, we should never fear to speak about sexual health of males because it's one of the main concerns that we've had as far as fertility is concerned. Data has it that infertility cases are rising, and mainly not because of females, but it's because of the males. So that is something that we need to address, and moving forward, we'll talk about it. So the sexual organ is controlled by sympathetic and parasympathetic nervous system, where a series of reactions are concerned, including nerves and hormones. The nerves play more important roles in the initiation of the sexual organ to get it to its state of ability to erect and perform its function. It's more of a nervous issue, and both parasympathetic and sympathetic systems play roles in sex, be it in the initial stages, in the ejaculation stages, and the termination stages. So what happens? What is this thing that we are worried about that will go wrong when erecting or when ejaculating? Why? So the normal way of having sex is that the man should erect. When the man erects, that is when you attain some degree of hardness that enables you to penetrate the female organ. There is no satisfaction of the female during sex without penetration. So that must be there. Penetration and ejaculation. Satisfaction of the man is more of ejaculation. The man gets satisfied when they ejaculate. That's when they get the satisfaction. But the female feels more of penetration, and whenever you have a problem with erection, then it means subsequently you will not be able to penetrate. So erectile dysfunction is a medical condition that affects some men, whereby they are not able to attain the, 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 the degree of hardness that a man may need to penetrate the female organ. Yeah, it's not very much of a problem as compared to premature ejaculation, which is more common than erectile dysfunction. I don't know if that is clear with most of you. It's more common to have or to get people with premature ejaculation, PE, than those guys with ED, erectile dysfunction. So with erectile dysfunction, everything else is okay, but the erection cannot be sustained, cannot be achieved. You may erect, but you're not getting the hardness that you want. And then premature ejaculation is where you erect, yes, the erection is there, you attain that degree of hardness, but it is short-lived, right? It's short-lived such that when you erect and then you penetrate the female organ, you ejaculate almost immediately. You know, we always say that medically there is no absolute time that is defined as a specific frame of time that you need to have sex before you ejaculate. There is no such time. But at least urologists tell us that a specific period of time, like less than 3 minutes, the reports before this was that this is a specific time within which you don't expect a man to ejaculate before the 3 minutes elapse. Some contexts give it 5 minutes, some give it 3 minutes, but the urologists say that for you to feel that this is a problem, it is not just about time, right? It is not just about time. Someone may have the ejaculation within 5 minutes, but it disturbs their mind. They feel like they are not satisfied. When it disturbs you, then that qualifies it to be an issue. When you have it within 3 minutes, but it doesn't disturb you, then that is not an issue anymore. So that's why we say that it is not just about time. So therefore, the time is significant to a degree, but not fully. Time itself does not qualify or does not give a guarantee of diagnosis of PE. And then the erectile dysfunction, the other one, that one is absolute. If you are not able to erect, then that is an issue from the word go. So many a times, the people who clinicians get to see report more of premature ejaculation than erectile dysfunction. Although many men may not be confident enough to report these issues, from a clinical or a medical point of view, I want to urge all men that it is not an issue that we should fear to address. And so in future, okay, not in future, moving forward, all men should be able to confidently address these issues when they arise. Because the earlier you report or the earlier you address it, the easier it is to get it managed. Sometimes when you have it for a very long time and you think that it's a norm, then you may have other problems that should be addressed, but you think that that is the main problem. That leads us to the next thing, which are the causes of both erectile dysfunction and premature ejaculation. Apparently, the causes are co-shared between the two issues. For example, the most common causes are, we have classification based on different groups. For example, we have causes that are related to lifestyle. We have causes that are related to comorbidities. I mean the diseases that coexist. Maybe you're having some other diseases. Causes that are related to physical appearance or the anatomy, or maybe the physiology of the patient in question. That also plays a role. So we will look at all this together and get to know really what happens. So sometimes, and this is the most common, is the lifestyle disorders. Most patients with premature ejaculation or erectile dysfunction have another condition that is underlying. This may not really be the cause, but it could be a leading diagnosis. For example, diabetes mellitus, most commonly type 2. People with diabetes, people with hypertension, high blood pressure, people with issues like cancer, people with heart diseases like congenital heart disease, people with stroke, or people who have had angina, or any form of a heart disease, are likely to present with these conditions. Why? Because it's more of a blood supply issue. You know what happens during sex is that for an erection to be achieved, blood supply must be maximum to the gonads. The blood supply to the penile vessels should be maximum. That's why the penile vessels need to dilate. When they dilate, so blood supply comes in, and the blood, actually the fact that the organ gets rigid, it's because of blood. It's nothing else. It's blood. The rigidity that you achieve by the corpus cavernosum and the corpus casponiosum, those things are out of blood supply. It even explains the mechanism of the medications that are used in management of these conditions. So before you start taking that medication, or before you address this as just premature ejaculation or erectile dysfunction, you need to manage those other conditions. In the event that it was not just there were other comorbidities, then you need to address the comorbidities before you address these other conditions. Otherwise, you will manage it, but it will still be there with you, because the cause, which is this other disease, be it diabetes or be it hypertension, is still there with you. So I'll not really dive much into the diseases, but you just need to understand that if you are having underlying heart disease, then you are likely to experience some of these things. Okay, I started by saying that these are diseases that affect people of all reproductive ages, and so it is not, or it goes without saying, that it affects both adolescents, it affects men of teenagers, and it affects men in their sunset ages. So everybody can be a subject to this. The next thing is about maybe something to do with physical activities. It's said men who, well, not that it's said, but the reality is that smoking, alcoholism or extreme alcoholism, lack of exercise or inactivity, and then be it for any form of exercise. Sometimes when I say lack of activity or exercise, I don't mean going for the gym. Even just walking is a form of activity. So smoking, I've talked of smoking, alcoholism, I've talked about exercise. We can also maybe talk about obesity and poor sleep. So when you are not having enough sleep, you will be interfering with your neurotransmitter levels, and neurotransmitters are also involved in such forms of physiological responses, and so you are likely to get this. So therefore, you should be able, prevention is better than treatment, so you should try at least to have some 6 to 8 hours of sleep, or undisturbed sleep. You should have some exercise, at least the recommendation is about 1,000 steps in a week, maybe, at least, the very least, 1,000 steps in a week. You should not have excess alcohol intake that will interfere with your kidneys and your heart conditions, or the functioning of your blood vessels. Then also smoking also has something to do with neurotransmitter and hormonal imbalance. So these ones are the other factors which you should really be careful about, so that you are not a culprit of premature ejaculation or erectile. The other thing is about physiological issues. For example, depression. If you are depressed, if you're having anxiety issues, if you're having stress, you are likely, or relationship issues, you are likely to encounter such problems. So if you are able to manage all these factors that we have mentioned, then we can say freely that any person should not have these conditions. And in the event that you have these conditions, then these factors are all managed and you are not getting well, then now we can go to pharmacology. It means that now we have to address it with drugs. That should be the last resort. even dietary responses, things that we eat. You know, eating a lot of junk food, sugars, a lot of oil should not be the norm, and salt. Use them, but to some level that we will be should be able to be controlled, especially salt. Salt is not just here. Salt is a causative agent of hypertension. You know the mechanism. Um, Maybe we'll explain more when we'll be addressing hypertension and other lifestyle diseases. But it's important to note that salt is a major factor. So I can give you a few food substances which have been alleged to be better or to be good for men to address these issues. No research has confirmed, okay, limited, I don't want to say no, but limited data is available, but there is some lead to it. Natural foods, fruits and vegetables, well cooked food, seafood for this reason, be it fish, be it omena, and grains, whole grains, kama beans. Those are good foods. When I talk about fruits, watermelons have been shown to be very good for reproductive health of males. And there are other things like the so-called mugombero in Luya land. Mugombero is also a good thing, so you should consider this as side forms of management, non-pharmacological. Okay, you should consider the exercise, you should consider losing weight. Obesity is a very big issue. Okay, so you should consider these ones before you go for meds. So before, it is not just about going to the shop or the pharmacy and getting the blue pill. We've heard of reports of blue pills being misused. We've seen media reports of how easily is it to access the blue pill, which apparently is a prescription only medicine. But because the techs outside there just want to make money, they will sell it to you at whatever cost. I don't know whether it's 50 shillings or 100 Kenya shillings. Whichever the cost, it doesn't matter. You will be ruining your life for that small amount of money just to have sex. So you need to, in addressing this issue, we need to check on two things. One, when is it a concern? When it's bringing issues within your relationship, then you should take it and treat it as a main concern. You should not have a relationship where your partner is complaining about your sexual ability or sexual capability. Sometimes some people have very high libido. That one we can understand, but in the normal way, if it brings issues within your relationship, then you should seek counseling from sexologists, from urologists, from peer counselors, because you need to know all these issues need to be explained to you. You need to be reviewed so that you can be able to understand what's going on. Also, there is another notion. So post-evaluation, then the urologist or the sexologist will make a decision whether yours is something that should be handled medically or not. Pharmacologically, both erectile dysfunction and premature ejaculation are addressed differently. Well, it's slightly different, not just totally different, but it's slightly different. Remember, what we are trying to achieve with PD is we are trying to achieve hardness or erection. With PE, we are trying to achieve sustained erection so that you don't ejaculate almost immediately. So the drugs that are used mainly for that main reason are mainly SSRIs, drugs called SSRIs, serotonin reuptake, serotonin selective reuptake inhibitors, things like dapoxetine, mainly used in that case, but you should not be using them over the counter. You need to be evaluated so that your doctor can be able to assess you and make a decision whether that is the best thing for you or not. Remember, black label. Those drugs should never be used when you have a heart condition. If you have a heart condition, kindly avoid the use of SSRIs. When I say kindly avoid, I mean it's not good for you. When we'll be addressing these heart issues in a different video, I will explain how. But just understand that it is not advisable to go buy for yourself dapoxetine in the name of you are addressing premature ejaculation. You need to check what really is happening so that you are not addressing the wrong thing. The next thing is about erectile dysfunction. Erectile dysfunction, people mainly use things like sildenafil or tadalafil, okay, to manage them. These drugs are mainly meant to vasodilate your penile organs. They are meant for other indications, okay? They are meant for other indications, but that happens to be the main indication for the commoners, which is not good. We've heard of, I say that we've heard of reports of deaths that arise because of the use of blue pill, that is sildenafil. It is not good. Don't use it without a prescription and without a direction. Don't make it a norm that every day you need to take a pill of sildenafil to have sex with your partner. It is that bad. It is not recommended, okay? So in another video I'll do a clear pharmacology of these medications, the SSRIs and the 5-phosphodiesterase inhibitors that are used, for example the sildenafil I've talked about, that are used in management of these conditions in depth, and we will see the reasons why it is not good for you to use them in such conditions when you have other underlying heart conditions. This was all about an introduction to these two conditions, erectile dysfunction and premature ejaculation, and it's a short video, but we'll do a lengthened one for the management because that is where the main thing is. Otherwise, thank you for watching.